Hello, hello, and welcome to the Kinesiotaping class. Welcome, welcome, welcome. I can see the place is on fire already. Welcome, welcome, welcome. This is absolutely fantastic. Welcome, welcome. Okay, so one thing I want us to do quickly is, tell me where you're watching from. Okay, tell me, introduce yourself in the comment section, and let me know where you're viewing this amazing session from. We're going to have fun tonight, a lot of fun, a lot of fun, learning about the basics of kinesiotyping. And I have promised that I'm going to do a few demonstrations as I'm able to. I'll definitely demonstrate a few techniques for us to have a good starting point for taping. Okay, so let me know where you're watching this from. You can mention your clinic if you want to, where you are practicing, and any other information that you think may just be useful. Okay, what country, what organization? Okay, so my name is Chijoke, by the way. I'm trying to send a message to Bolanle so that she would join me on screen and help with coordinating this. Okay, so let me do that quickly. I can see a lot of people already. I can see a whole lot of people. Fantastic. I see you, Mary from OAU, Borno, Nigeria, Joseph Minor, Taye Tosin from OAU, Lawa Abdul Wasiu, watching from Kwara, Nigeria. Gold is watching from Osun State, nice. Benjamin from Bini, Blessing from Oka, interesting. Enugu, Nigeria. Emmanuel from Osun State, okay. Anambra, please include Katie in pediatrics. Okay, okay, okay. We'll start from somewhere. Okay, so ABUTH, Bauchi. I'm seeing Apollos. I'm seeing Favor, Aisha, Ibrahim, Franklin Wobi, Ibat, me. So yes, yes. Keep the introductions going on. Keep it coming. So you're all welcome. I'm going to be turning on the screen shortly. But like I said, let me locate Bolanle's DM and send her a message quickly. So what I want you to do, okay, Bolanle, I noticed that people are not, people are still joining this group. So what we're going to do is, I would need her. I hope she's live. Uh, so I would need her to be actively reposting this link in the group. Okay, the link to the live session. So if Bolanle, if you are here, please do that for me. Okay, so that you don't miss out. Just keep doing that. Repost this link. Okay, so like I was saying, I want you to do something quickly. The message that brought you to this group, to the training, you can also repost that, as well as the session itself. Okay, you can repost this session to your friends, with your friends rather, who are physiotherapists. Okay, tell them about the training that is ongoing and you want them to join. This is it's a very, very amazing opportunity to learn this, at least the basics. And the truth of the matter is, when you have learned, okay, Bolanle is here with me, amazing. We are 93 now. Fantastic. This is fantastic. This is fantastic, really. So when you have learned about the basics of taping, you'll find out that every other thing falls easily. It's going to be a lot easier for you to do certain things with what you have learned, right? And the truth of the matter is, A lot of people just they assume that they know, but they don't. That's also another undoing some people experience, right? So they assume that they know how to apply this, that they've seen it being used, and then they just strap a bunch of tapes on people, and then just experiment with the whole thing, right? But if you understand the principle behind it, if you understand the mechanism behind your applications, you can basically attempt to tape clients, and you will see the results. Okay, I assure you, you will definitely see the results. And like I was sharing yesterday in the demo session, so that people will not get angry that we had the session yesterday, it wasn't a full session, it was just a demo. Okay, so um I was saying that 9 out of 10 times that I apply this, for my patients, the result is usually very instant, and it's very pronounced. I mean, it's not guesswork. It's not what you are doing and you're not really sure what is helping the patient or not. 9 out of 10 times I can tell you categorically that I have been able to get significant results with my patients just by taping. So a lot of times I get to just, I get to finish up my treatment, and they're like, okay, I'm still in pain, but it's not as much as before, but then I'm still in pain. And then I apply I do skin toileting, wipe off the skin clean, and then I apply my tape, and I ask them to re-examine or re-evaluate, right? And then the pain significantly drops again further down from there. And then I can say, yes, this thing's really working, right? So not like you are trying to guess, or you're trying to tell them, oh, just wear it. Maybe in the next in the next 10 days it may work. Just wear it like that. No, I mean, you usually you see the results instantly. So I'm going to be calling on Bolanle to come and do the opening serenre, whatever, before I officially step in to kick off with the session. Bolanle, you have the floor. Please, you can kindly unmute yourself. I think you're still muted.
Yeah.
Okay.
Sorry, good evening, everyone.
Good evening.
How you all doing? All right, so you're all welcome to the virtual training section for kinesio basic. All right, for cardinal PTDS, which is physiotherapy day of service, one of our projects is reaching out to students and professionals to give them at least a skill that will enable them enhance their practice. And so that is why we came up with the training for kinesiotaping because over time we found out that people want to learn this but not have the opportunity yet. And we saw this as a great way to give back to the profession at large. And so with me here is PT Chijoke Otipa. I hope I pronounced that right.
Yeah,
And
you
so
did.
he's going to be the all right. And so he's going to be the facilitator for this training. I hope you all have an amazing time. Thank you.
Good, good. So I'm just going to show my face for a while, so that we'll then jump into the presentation for tonight. Okay. And permit me to take you out for a second. Bolanle, I'll bring you back on stage again. Okay. So this is okay. Just give me a second, please. I'm trying to hang this device in a way that it won't be falling off my tripod. But I guess let's just resume. Let's just resume. I'll figure things out. Okay. So I believe you are all eager to learn this tonight. I'll be sharing my slide. I'll be sharing my slide. So when I share my slide, then I can open my camera. So just before I do that, I want to confirm that you can hear me loud and clear. I want to confirm that you can hear loud and clear, and then you can see this slide. Okay. So yeah, I know it's not yet up. So this is my presentation. Okay. So I'm going to be taking you off for a while. Good, good. So this is what we have here. Introduction to basic applications of kinesiotaping, enhancing rehabilitation through taping. Forget the whole display. I think it's because I'm using another software, so it's not displaying so well. But then let's move on. Let's move on. I would want this to be very engaging. Let me know when you can, when you are enjoying the presentations. I would love to be getting feedback in the comment section. Now, you know, let's go to the next slide. No. So these are the things that you'll be learning here, right? Remember, I said this is going to be um basically it's going to be, the introductory class, an introductory class to taping. So these are the things that we'll be covering. Okay. So introduction, definition, brief history, basics of application, types and properties of kinesiotapes, the theory, understanding how it works, right? Then we're also going to be looking at this contraindications, general contraindications and precautions, then aftercare, okay, and then a few case studies. Now, what is going to happen with the case studies is that I will do that in the group chat, okay, in the WhatsApp group, okay. So definitely all of you here are already on the WhatsApp group because I was trying to upload some pictures here. It was giving me issues uploading. So I'm going to do that in the WhatsApp group. I'll give you case examples, right? The ones that I have done, people that I have taped, and I'll even go ahead to tell you some stories around that particular technique that I used. So that's it. Now, this is kicking off, right? Introduction. What are kinesiotapes, or what is kinesiotaping? I'll give you a brief story. I'll give you a brief history about this. It was invented by Dr. Kenzo Case in 1973 precisely, right? He happened to be a Japanese chiropractor. So he tried to invent something that would help continue his treatment while he was away, right? Just the way splints work. But then he wanted something that would be more dynamic to allow more movement for his patients and more freedom for his patients while achieving certain results like pain relief and support. So that was how he started experimenting with tapes and found out that these hypoallergenic tapes, what I mean by hypoallergenic is it doesn't really react with the skin. These tapes can actually give certain responses or certain effects, right, that he wanted for his patients. So that was how he started popularizing it. And it was during the Olympics that athletes, including football stars, American football stars, basketballers, started using these fancy, beautiful tapes, right? And it blew up sort of, and people started knowing more about taping. They started making more inquiries. It got attention, a lot of attention, and then more and more people began to learn, right? Physios began to take this up and learn how to apply this for patients. So that's just the brief history behind kinesiotaping. Now the next thing, it is a therapeutic technique. Taping is a technique using an elastic tape to support and stabilize muscles and joints without restricting movement, which was the goal for Dr. Kenzo, right? It was basically homeostasis. maintaining the body's external environment or internal environment while healing takes place. Okay, so the next this okay, this is how it got to spread more. I would have put more pictures, but yeah, this is just enough. And this, the first player, I don't know why I would have removed the names here so that we'll guess who these players are. Of course, who doesn't know Cristiano Ronaldo? I made a mistake with the spelling. Please, you people should not come for me. But this is Cristiano Ronaldo, a very popular footballer. And what you are seeing on his calf muscle, the left calf muscle, is actually a kinesiotape, right? So maybe his physio is good with kinesiotaping and is using it for him. And by the right, we have Mario Balotelli, okay, the one and only Mario Balotelli. And that on his back, those things are also straps of kinesiotapes, okay? So a lot of times people would say things like, oh, this thing doesn't work, it's just sham, it doesn't work, it's just placebo. I know a lot of people love to throw the word placebo around. Any little thing they'll say, it's anything people don't understand these days or anything they don't know how to do, they will tag it as placebo. Okay, some people don't even care about, they don't bother to do any form of research or actually try out stuff. Once they don't understand it, it's placebo. So it can't be placebo and our guy Cristiano Ronaldo will not be noticing that it's actually um not giving him what he's looking for. So let's go to the next slide. The types and properties. I won't bug you with a lot of details here. I won't bother you with a lot of these details. This information is something you can find online. You can find it anywhere, right? um but kinesio tapes contain the text tapes, which is usually the most recommended one, kinesio text, right? It contains either 100% cotton or elastic fibers, and elastic fibers, or a blend of polyester and cotton with elastic fibers. Now, applied on the proper backing using an acrylic adhesive with 10 to 15% stretch. At some point, I'm going to turn this slide entirely, and I'll remove the slide and I'll bring myself on stage, and then we'll do some little exercises, right? I'm going to be showing you both how to cut the tapes and how to make certain strips of the tape and all that. So just stick with me. Now, the next slide I have here is the other properties of the tape. Ability to stretch. It's stretchable, okay? It's elastic. And I mentioned hypoallergenic. It means that they are safe. They do not react to the skin, to most people's skins. Okay. So a lot of and that's why it's important to actually know the brand of tape that you use. It's important to check the brand of taping of tapes that you use, so that it's not once you notice that it's always itchy, your patients complain that this is itchy, or you try it on yourself and you find out that it's uncomfortable, and after a while maybe it starts itching you or your skin starts to redden. It means that there are actually some allergenic properties in that particular tape that you are using, so you have to find a better alternative. Now, recoil back to the anchor that is applied without stretch. These are some of the other properties. And I will explain all this to you. I will explain all of this to you. Drying time after being wet is about 5 to 10 minutes. I have a tape on my shoulder. I mean, I have some straps of tapes on my own shoulder right now. And, just this morning after I took my bath, I was preparing to go out. I just had to air dry. And yeah, within 3 to 5 minutes, it was dry and I could go. Now, heat activated adhesives. That is why after the application, it's advisable to just rub over the tape with a backing paper and activate heat. Heat it up a little bit. That helps to activate the adhesive, right? And it can be worn for several days. It can be worn for up to 5 days, sometimes 7 days, right? So usually I tell my patients, because it's one of the questions that they would ask you when you begin to apply this for them, you know. So sometimes I get to tell my patients they can wear this for 5 to 7 days. Okay. 5 to 7 days, for as long as it can stay on your skin before before it starts to weaken, and then you can take it off, right? But if don't worry, what I want to say now, I'm going to say later. Now it's latex free because a lot of people react to latex. Now, Bolanle, please go to the group chat and repost the link to this session. I know some people probably joined later and they would want to have access to this. So please go to the group chat and repost the link to them and urge them to join. Now, the next one is, what are we looking at again? We are looking at okay, the properties. I've already mentioned this, and these are some of the common injuries that I'm trying to zoom in. Oh no, no, I'm trying to zoom into this. Okay, so these are some of the common injuries that. Oops. Okay, I think, yeah, these are some of the common injuries that we can apply taping for. Sorry about the good. You can see neck strain, shoulder pain, tennis elbow, back pain, carpal tunnel, Achilles tendinitis, gluteus strain, hamstring strain, plantar fasciitis, or um, shin splints, calf strain, ankle sprain, full knee support, quadriceps strain, rib pain, golfer's elbow, wrist pain. And looking at this entire image, I think I have literally applied for all of this. I have done application for almost all of this. Apart from uh, gluteus pain, I don't think I've done any application for gluteus pain. No, I haven't. But every other thing here, hamstring, plantar fasciitis, shin splint, calf strain, every other thing here, I have actually done that. And it's pretty interesting because the more you do this, the more you master it. The more you attempt to tape people, the more you master the art of taping. So the next one I'm going to talk about is, let's go to the next slide. And this is, okay, I've already talked about the properties and we won for several days. 4 types of tapes. I'm not going to bore you with this. These are just different types that are available. There are some for animals and there are some for human beings. The last two are for animals, the equine and the canine. And the equine, I think the equine is used for horses, taping for horses, right? But these first 4 types, they are for human beings. Different textures for different races. There's even a race that is used. I mean, a texture of tape that is used more for Asians, right? Because it is believed that a lot of them have lighter skin textures. There's a texture that is preferable for older populations. Okay, so that is why the information is important. Otherwise, it's not really something to worry about. Now, the theory or principles of application. Okay, so the first one is based on neurophysiological mechanisms and the effect of mechanical stimuli on various systems in the body. Now, this is called biotensegrity. This is called biotensegrity. And that is that the don't worry about the plenty grammar. I mean, the whole biotensegrity thing is just it's just the name. So okay. So now, can you still hear me? I'm trying to see the comments. Sorry about the pause. I'm trying to see the comments, but I'm not really seeing anything. Okay. Can you hear me? Once I confirm that you can hear me. Once I start seeing the comments again, I'll kick off again. Are you with me? Is it flowing so far? Is it flowing? Is it flowing? Are you enjoying this? Are you enjoying this presentation? Okay. So yes, I was promising that I was going to show my face at some point so that you can see my face. So this is it. This is me. Okay. So yeah, this is my face, and I'm trying to. Okay. Okay. So uh, back to the presentation. The display I'm using is going to make my. Okay, let me see if this is going to enlarge. Uh, okay, so now, good, good. This is what we have, and talking about the based on neurophysiological mechanisms and the effect on mechanical stimuli, and this is why this is important. All these basic principles and theories, this is why they are important, right? Because somebody is going to ask you, your patient is going to ask you, why does this work? You know, oh, I came in with pain and you strapped something on my knees, and now I'm not feeling that pain as much. What the heck did you just put on my knees? Like, what is this thing? So you have to be able to explain to them that it is not voodoo. I mean, that is not some weird stuff, right? You have to be able to let them know that this is exactly how this thing works. Other professionals are going to be skeptical, maybe. I have a doctor who came for, I mean, who I was attending to at some point, and I happened to use this for him. And before I did, he was just asking me a whole lot of questions, like, oh, what's this thing? How does it work? Is it like all this network marketing, stuff that people peddle around and all that? How does it really work, right? So I started breaking things down for him, explaining, oh, this is how it works. This is how, because of how it attaches to the skin is connected to the other tissues beneath the skin. So that was why I mentioned biotensegrity earlier. Now, the central nervous system, the skin, the fascia, the circulatory and lymphatic system, they are all connected. Okay. So what happens to one will eventually spread out. Okay. So this is the skin. If something is going to attach to the skin and kind of lift the skin up, it's going to affect all other tissues underneath the skin. So the skin, the subcutaneous fats, subcutaneous tissues, the fascia, the blood vessel, lymphatic vessels, and then the nociceptors. That's also something that a lot of times we tend to underestimate, right? So when you decompress the nociceptors, the pain receptors, the pressure on them reduce. Sometimes the reason why someone can be having a lot of pain is the associated inflammatory process that is going on, the inflammation and swelling that are within tissues, right? So the moment you now decompress that, the pressure relieves from the nociceptors, the pain receptors, and the patient eventually feels less pain. Now, not just will the pressure decrease on the pain receptors, it will also free up the blood vessels there. Okay, it improves blood circulation there by freeing up those blood vessels, and more blood come to the area. There's going to be ease of renewal of inflammatory mediators, and then the patient is able to recover faster from that painful situation or condition. Now, the principles: elasticity. right? It mimics the skin's elasticity to provide support without limiting range of motion. And this is where kinesio tapes are of more advantage when it comes to injury management than you know, rigid tapes and splints. Okay, it allows for more movement. It doesn't limit movement, so it means that you can, okay, patient can come in with an ankle sprain, an acute ankle sprain, and when you are done with your treatment, you apply the tape and then they feel less pain. They can now tolerate more movement, they can tolerate more movement, they can tolerate more pressure, and then they can tolerate more load because of the effect of the tape, right? It doesn't limit the motion, because sometimes what happens with, you know, with treatment protocols is a patient can come in with a certain condition that, you know, causes them pain, and then we try to address that by actually limiting movement. We pack a splint and then put in the position and it limits the movement, or, you know, a rigid tape or something and bind, or bandage and just bind and then just to protect and all that. But at the end of the day, when you are done with the acute protocol, the acute management procedure, you have reduced the pain substantially, yes, but then you now start working another thing altogether, and that is to break the adhesions that you have caused by limiting movement. Okay, but taping allows for movement while it also helps to relieve the pain. Now the next one is adhesive quality, right? Uses a medical grade adhesive that is water resistant and breathable. Breathable simply means that, you know, the tape has pores, right? So it's not like clothing that will just soak, and or it is not something that will block your skin. Okay, so it has pores, so water that is on it can still evaporate, and then you don't just sweat and retain sweat. It you know, it evaporates. Now the next thing is what we're looking at here. Proprioceptive, the mechanisms, other mechanisms of action. Proprioceptive facilitation, it enhances body awareness and movement. I have had patients in the past that I applied this for, and they will come back the next appointment to tell me that, oh, I feel much better. And not just that, the pain has reduced substantially. It serves as a reminder for me to not go into the awkward postures I was used to in the past. So each time I try to, you know, to sit down to work on my system, and then I try to slouch, I notice that pull at my back, and it reminds me to correct my posture. So it enhances body awareness and movement. And remember that proprioception on its own is a sensation. Okay, it has fibers, nerve fibers, that are responsible for carrying input of that proprioception, and that is the body's sense of awareness in space. Okay, awareness of position in space. That's what proprioception is about. Now, that also kind of mimics the pain gate theory, right? And that's one of the things that we'll be talking about here. Muscle support is one of the ways this tape acts. Sometimes muscles can get overworked sometimes, and that's why you see a lot of footballers these days, Osimhen, Cristiano. You've already seen Cristiano Ronaldo. You see a lot of footballers, Gareth Bale. You know, they have tapes on their bodies. It's not, they know what they are doing. They've played without it and they played with it, and they know what works for them. You know, so it's more like an added advantage that you are having an additional support for the muscle so that they do not fatigue easily. So for me, I would even make a case for the use of kinesio tapes in preventive medicine, you know, in sports injury prevention particularly. Now, the next one is pain relief. Decreases pain through neurological suppression. Neurological suppression. One is by that manual contact and then the micro gliding on the skin upon every movement, right? It helps to reduce pain. Now, it's more like it's giving a form of massage, gentle massage on the skin that you may not be able to see, but because of the way it is attached and because of the way it affects the skin and then the fascia, it induces gentle movement in that area, right? and it helps to activate the pain gate theory, activate the pain gate, so to say. What do I mean? The non-painful stimulus, remember the pain gate theory that we all went through in our school days. For those of you who are still in school, you are probably going to go through it, or you have done that already. But non-painful stimulus blocks painful stimulus at the lamina 2. I'm trying to remember. We called it substantia gelatinosa of Rolandi, right? This lamina 2 of the spinal cord before decussation, before it crosses, right? So these sensations kind of compete for um what are they competing for? They compete at that point in the spinal cord, right? So what now happens? This is how your TENS machines work. This is also part of the reasons massage helps. Sometimes something hits you on the head, and then by instinct, you just start rubbing, right? You are activating. This is like crude touch, right? You are trying to send those signals because they travel through a similar path. It blocks the painful stimulus. Same way, this touch on the skin, this contact it's providing can help to activate that, and block painful stimulus from actually getting to the brain. So um lymphatic drainage, it can help to improve circulation and reduce swelling. Now the next one, muscle facilitation and inhibition. This is also one of the ways it works. Now, depending on the taping direction, depending on taping direction, these tapes can actually help to facilitate muscle action or inhibit muscle action. Okay? Now, I'm going to say this here, even though I'll say it again. If I am taping from origin to insertion, right? Let's just assume, right? I'm not using, okay, okay. So I'm going to have I have my whiteboard here. I've done series of lectures for different people on this, so a lot of times I get to illustrate some things on my whiteboard, so I had to. You're making me open your marker. So this is the last class I did for somebody. It was a private. A lot of times I get to use my own body. I get to use my own body a lot to demonstrate. But sometimes I just draw this on the board for easy understanding. Now, this is what we're trying to explain here. Maybe I'll have to use my left. So now, if this is okay, let's say this is somebody's shoulder, right? This is somebody's shoulder. This is somebody's shoulder, right? This is the shoulder going to the head, and this is where we have the deltoid muscle, and then this is the biceps, right? And then this is the forearm. Okay. Now, at this point, if I am taping, remember, this is the deltoid muscle. So if I want to facilitate the lateral deltoid, the lateral fibers of the deltoid muscle, I would want to tape from this region down towards this region. Okay. Now, this square here, there's no tension there. We'll get there. I will explain all these things. I will explain this zero tension here, zero tension here. So remember that there is no tension and there's no tension here. Then there's a stretch here, right? And I will explain this thing to you. Now, what I was trying to say here is this: depending on the direction of the tape's direction and tension, you can actually inhibit muscle action or you can facilitate muscle action. So if you want to facilitate this muscle, you want to tape from origin towards the insertion. Not exactly, it doesn't have to be exactly on the point of insertion. It's not a must, right? It doesn't have to be exactly on the point of origin. It is not a must. But from this direction, You are passing that muscle and then you are inserting it at this point, right? Now, the direction of recoil is always from the this is called the end. This is called the end. Sorry, my handwriting may be a bit terrible because I'm not used to writing with my left. So this is called the anchor. Okay. So if I am taping from anchor to the end, the taping direction is always going to be from this end back to the anchor. This is the taping direction. So if I'm taping from here to here, the direction of recoil will always go back to the anchor. It's going to the anchor. So this is the recoil direction, okay? Because I started my taping from here to here. Now, why is this so? I wish I had a rubber band. I wish I had a rubber band. But maybe I'll just I'll use this tape. I had to open a fresh tape for you all. So I'm going to quickly show you something, right? And I'll do more demonstrations with time. I'll do more demonstrations. So this is what I want to show you, right? So I'm cutting this tape. I'll still teach you how to cut because everything here is about technique, right? Everything is about technique. So now this is what I have here. And I am if I am taping from here down, I'm opening the tape now, okay? Opening this tape, and this, right? If I want to tape, let me use this place because I'll still use this one to demonstrate. So if I want to tape from here, right, this way, and go this, you see, this is my anchor. This is where I'm starting out, right? And go down this way. Okay. Can you see that when I pull this and I leave it, it goes back up like this. Okay. So let me use this as an example. Let me use this as an example. It may not really give me what I'm looking for exactly, but you see, when I pull down like this, right, and I leave it, it goes up. So what you are looking for is that recoil because you are starting from here. But if I start from down here to put this and then stretch it and go upwards, when I leave it, it's going to come down, right? So the same mechanism happens to the skin. So when I go down like this, anything underneath it, it drags it back to the ankle. So that's your recoil direction. Don't worry, I'll explain further. I just did this so that you have a good introduction background for this, right? Okay, so the next one is posture correction. Provides feedback to help maintain proper posture. I already mentioned this when I was talking about proprioception. Now, edema reduction assists in lymphatic drainage to reduce swelling, right? Why? I've already said what it does. Bolanle, can you hear me? Can you hear me? Is there any problem? I just saw a message now. So let me confirm. I don't know if okay. So can you all hear me? Can you all hear and see me? Okay, because I wanted to know. Bolanle, you sent me a message. Please, I'm seeing your message. Let me know what you want to say because I it just popped in, so that was why I paused. Okay, so I just wanted to be sure that I have not lost connection. Okay, good, good, good. Could you minimize the slide so that we see the board better? Okay, okay, okay. I'll still do that. I'll still do that. I'll do that. No problems. No problems. I'll go over it again. Don't worry. I'll go over the demonstration again. Is it possible to use someone or yourself to demonstrate? Okay, okay. I'll have to pull my shirt, but don't worry. Don't worry. I obviously wish I could use someone. I obviously wish, but of course, sometimes things don't happen, the way it is in your head. Yes, I wish there was someone to to follow to use, and but this time is 7:54 p.m. I cannot go and catch my neighbor and tell them that I want to use them and demonstrate something. They'll punch my eyes. So back to what I was saying. Back to what I was saying. I'm going to show you these things. Let's go through this first. I'll come back to all the explanations. I'll come back to it again. Okay, are we good? Okay. So now the next one is, let me even turn off my camera. The next one is the next one is edema reduction, right? Assist in lymphatic drainage to reduce swelling. The next is the basics of application. Basics of application. Don't worry. Somebody saying I can't see anything. We are not seeing. Okay. 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 Please don't worry. I'll go through it again. I'll go through the whole thing. I'll go through everything again. So I think that was why Bolanle was trying to call my attention. Oh, okay, 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 okay. Sorry, sorry. I put my phone in landscape mode, so it was making it easier for me to see. But I didn't know that you were not really seeing it. Okay, I didn't know you were not seeing it the way um you know we couldn't see the video. No problems. I'll go through it again. I'll go through it again. Don't worry. Now, complete the basics of application. These are things that you should know when you are applying kinesiotape for your patient. Okay, basics of application. Complete number one, complete the patient's assessment. There's something called manual direction testing. Okay, manual directional tests that you can administer for the patient to actually know whether taping is indicated for the patient. I see the mistake a lot of physios make when it comes to kinesiotaping. They just see a patient, oh, yeah, this patient, oh, the patient will need taping, oh, let's just tape, and you at the end of the day, you tape and then nothing really happens. And that's because you didn't go ahead to do a good examination, right? There are directional tests that you can use to determine whether the tape will benefit the patient or not. Okay. So if you experience significant difference with manual direction test, taping is indicated. Okay. I will explain all that to you. I will explain all that. Now, follow contraindications and precautions while applying tips. Very important. Now, this is how to prepare the skin. Clean and dry. Ensure that the skin is free from oils, lotions, and moisture. Very important. Okay. Shaving, trim hair if necessary to enhance adhesion and comfort. But please, if you can hear me, if you are hearing this at the sound of my voice, please do not use shaving stick to shave. Don't use razor to shave before taping. Don't use razor of any kind to shave before taping a client. Please don't, for many reasons. One is that there's risk of injuring the client with the razor. Then two is that the main reason, in fact, it is very, very, it can be very irritating. So if you use a razor and shave, and then at the end of the day um, you apply the kinesio tape, right? The tape on the patient's skin, it can give the patient a lot of discomfort, bumps, irritation, skin reactions. Okay, so do not use razor to shave. Instead, get small scissors. There are these very portable scissors that you can use to 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 trim the hair a bit. Then you can apply the tape so that it sticks to the patient's skin. Okay, now the next one is um skin sensitivity test. I do this for myself. Sometimes you may not have the time to do it with patients and just wait for them to come back after hours, to check the reaction, if there's any skin reaction. So apply a small piece of the tape to check the allergic reactions. You can apply the tape, leave it for an hour or leave it for 30 minutes, then you know pull out the tape. Don't pull out aggressively. You can use baby oil or you can use soap, apply it on the tape and leave it, let it set in for a bit, and then you can gently take it off. There are techniques for actually taking this off. When I teach people, uh you know when I teach people taping proper, it can take up to anywhere from 4 days to 2 weeks to actually teach, depending on the pace that I'm able to work with the person. If it's one-on-one or group session, we do this skin removal sessions, tape removal sessions. Is not actually easy. It's not easy. If you've pulled out kinesio tape from somebody's skin before, you will understand what I'm saying. It can be very difficult. I mean, it can be very painful if you don't do it correctly. And if you do it wrongly, you can injure your patient's skin. Okay? So skin sensitivity test is basically to check whether it reacts to that person's skin. Okay? If you notice that, okay, a small patch on the skin after a while begins to react, begins to itch, you remove it and the place is red, there's what is it called, erythema, right? And then rashes or something, then it's a sign that, okay, this is probably not for the patient. Okay, you should find an alternative treatment modality for this patient for not taping. So okay, so good, good. Don't worry, I'm going to explain. I'm still seeing comments. I'm going to explain. I'm going to explain. I'm going to demonstrate. Applying the tape, right? These are the things that you need to do. Measure the tape and cut, right? Measure the tape and cut. Cut. Ensure that the edges are rounded. Okay. Now, apply the first part of the tape without any stretch. Then stretch the tape according to desired effect and apply it smoothly on the skin. Gently rub the tape to activate the adhesive through heat. Again, don't panic. You will see me. In fact, I'll take off my jacket, I'll be my shirt, and I'll demonstrate with myself. Okay, so that you are able to understand this very well. Okay, so now, um manual direction testing. Use manual muscle test to determine the appropriate direction and tension for tape application. Manual direction test, that shouldn't be muscle, it's direction. Okay, now adjust according to response. Modify the tape application based on the patient's response to manual tests. Now, the next one, general step-by-step guide. Okay, we are doing this so that once you understand these basics, applying the tapes will not be hard. Once you understand the basics, applying it won't be hard. Mastering it won't be hard. Okay, general step-by-step guide. In fact, let's go back. Okay, we are seeing all these things. Apply the tape on dry skin, avoid touching the adhesive side, remove body hair if possible. You can trim or shave, but don't use razor. Once the tape is applied, activate heat sensitive adhesive. Follow the tension guidelines, round all the edges of the tape to prevent premature peeling. Then reassess to this is something that you should always do after the application, just to be sure that the application actually helped, the patient. Reassess after application. Now, next is the continuation. Inform the patient to defer activities that cause perspiration for 30 minutes if possible. Inform patient to remove the tape if their skin begins to react to it. Then teach the patient and caregiver how to remove the tape. Very important. And now, contraindications. Before we go into contraindications, should I demonstrate before we go into, should I pause here and demonstrate before we go into contraindications, or should I just continue? Should I pause and demonstrate before I continue? Or do you want me to continue before demonstrating? Somebody said maybe a physical taping on myself could be helpful. If you want me to pull my shirt, I'm doing that already. Okay, so demonstrate. People are saying demonstrate, demonstrate, demonstrate. Some people are saying continue, continue, continue. Okay, yes, pause and demonstrate. Who is ready to rig this election now? Continue, continue, continue. Okay, okay, okay. Pause and demonstrate. Continue, continue. Okay, this is what I'm going to do, right? This is what I'm going to do. I'm going to pause and demonstrate some of these things, right? Then I'll continue with contraindications and the precautions, okay? Because I know we need to have that experience. We need to have that, that feel of actually seeing how this thing is done, okay? Before we continue. So, well done. Bolanle, I don't know if Bolanle next one after mine wins. Joseph Minor. And eventually it's demonstrate. Okay, so I'm going to demonstrate. Don't worry, I'm going to demonstrate. I don't know if Bolanle is still here with me, but if she is, please check the group chat and resend this link to the session. I know some people must have joined as well. Let me go to the group chat. So let me go to the group chat and resend. So a lot of people are still joining. Okay. So I just resent the link so that you know okay, I believe you can hear me. I got logged out. I went to the group to upload some things. Okay. To upload the link. So so I've just been looking for what to wear so that so that I'll be able to do this demonstration. Okay, so give me a second. Give me a second. That's why I left. I'm coming back right now to put on something or just cover myself one way or the other. Okay. So I'm back. I am back. And I'm going to do this. Okay. This is funny. Very funny. So yeah, don't worry. You'll see me. You'll see me very soon. Okay. Bolanle, I'm trying to see your message. I was asking for your I was asking for you. They can't see the board. Okay, 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 okay. Sure, sure. I'm doing that now. I'm doing that right away. So you'll see my board. For those who have not been seeing the board, you see it now. I really apologize for that. It was this the display I was using. It wasn't really. I wasn't seeing your comments. So now I can see them. Okay. So can you see me now? I don't go dressed like old papa. Okay, Bolanle, I want you to I want you to, to give me feedback, right? Give me feedback. So this is basically what I want to explain to all of you. Back to this. Back to this, right? I believe you can see it better now. Now this is let me wipe it and then start all over. Okay? I believe that will appease you. Wipe it and start all over again. Mm. Can you imagine how strong this is? That it actually damaged my whiteboard. Can you see? I just pulled this, I ripped it, and it damaged the whiteboard. So this is what happens when you try to pull too forcefully while it's on your patient's skin. It can actually injure them, right? So now back to what I was saying. Back to, you know, give me a second. Let me wipe this off. Okay. So this is what we have, right? And I was showing you this, okay? And I drew something like this. So let's say this is the deltoid muscle, right? This is the deltoid. This is the lateral fibers of the deltoid. And then this is maybe the triceps, and this is the guy man's biceps, abi forearm. This is the forearm. This is the tricep muscle, the biceps, right? The deltoid. So what I was saying is this: if you want to apply, let's say, to activate, because I said you can either inhibit or um you can facilitate muscle action. So if you want to facilitate the action of these lateral fibers of the deltoid, right, you would want to tape from towards the origin of the muscles, which is around here, down towards the insertion. So this now, this, remember I said the drawing may not be so, it may not come out so nice because I'm actually using my left because of where my screen is and where my camera hole is. So this is the muscle that you want to activate. Let's say the lateral deltoid muscle here, right? This is where the muscles are. Okay, but where will I start my taping? I'll start around here towards the origin. Not it doesn't have to be exactly on the origin, but towards that direction, above the region that you want to apply. Now down to here, right? And now this, from this zone down to this zone, is where we have our therapeutic zone. This from here to here is the therapeutic zone. Okay, that is where the effect of the tape is felt. So you are starting from here, which is zero tension. This is called your anchor, right? And this is called, this one is called the end. Okay, zero tension at the anchor, zero tension at the end. Now from this point to this point, you now have your therapeutic zone. That is where the action of the tape is felt. Now if I want to activate the muscle, if I want this muscle to get activated, because I already know the action of the muscle. The action of the muscle is to you know, to elevate, laterally elevate the arm, you know. So taking it up this way, this is the action of the muscle. So if I want to activate that muscle, I would tape from origin towards the insertion. When a muscle contracts, it contracts from insertion to origin. Okay, now so when I tape from here to here, the direction of recoil is going to be the opposite direction. What do I mean? So I've started my taping here and I'm going down to this point, this way, right? This way. Now this is where I started to do the taping. This is the direction of the taping. The direction of recoil is opposite to your taping direction. It means that if I tape from here to here, the recoil direction will be from here back up, from here back up. Okay, so this is my recoil direction, and that's what I'm achieving by taping like this from origin to insertion. I hope it's clear. I hope it's clear. So Bolale, I am trusting you for feedback. Please give me feedback in our own chat, in our own hidden chat, so that I'll know how it is coming out for people who are watching. Okay, so I would have to maybe turn and see this and see. Okay, much better. Okay, good, good, good. You can see a tape on my shoulder. This tape is not, it's not for fancy, it's not for the class, it's not for class. I have a reason for having this on my shoulder. Now this that I just explained is for activation of the deltoid muscle. Now if I want to inhibit the action of the lateral deltoid, right, if I want to inhibit the action, what do you think I would do? Where will I start my taping? Where will I start my taping? If I want to inhibit the action, where will I start the taping? Can somebody say something? Somebody say something. Origin, or from origin to insertion, or from insertion to origin? If I want to inhibit, tell me. I'll look out for your comments. Ha ha ha. Hey, God, I beg. What do we do now? Ah, these people have done, they have done terrible things. So, so if you are watching from another country, don't worry. I cannot explain what just happened now. So, okay, this is what we're going to do because it's going to be a distance. It's going to be a journey for me to go and start turning on my generator now. So, let me see. Let me see comments. Okay, let me see comments. Who is still following, please? Who is following? Who is following? Okay, okay. So I know people are going to join this session. Ah, I know people are going to join this session from India. You know, some people are going to watch the replay from different countries. So um, I can't say stuff. I can't say a lot. Okay, okay, but like this is a power cut. It rarely happens, but you know, hey God. So yeah, back to what I was saying. Back to what I was saying. Okay, good. If I want to inhibit the action, if I want to inhibit the action, I'll tape from insertion to origin. Okay, insertion to origin. So you want to expose us. So if I want to facilitate, I'll tape from origin towards the insertion. The direction of recoil will take it back to the origin, like we'll pull the muscles back to the origin, kind of. So enhancing concentric action of those muscle fibers. Okay. Now, when should you even inhibit? When should you facilitate? So if you notice that this particular muscle you're working on, maybe there's overriding muscle action, right? There is, tension, there's muscle spasm, and that is causing the pain. Now, for a lot of people, it could be, the back of the neck, it could be upper trapezius. Yeah, that's those excessive work done by the upper traps can start sending painful signals and all that. And it's like, oh, this is very painful. And you can literally feel that as you glide through the skin. Now, eh, not too well, not too well. Up. So they brought it back. They brought it back. Yeah, these things happen sometimes. They just happen sometimes. So, like I was saying, hey God, I beg. So, oh God, God. Mm, I'm grateful to God for making this a possibility. I'm happy. So this is what I was talking about. This is what I was explaining. If I want to facilitate, I am going from origin to insertion. If I want to inhibit, I'm going from insertion to origin. So it's not, remember, I didn't say it has to be exact, because sometimes you get overwhelmed with details like this and you are so fascinated about it. I mean, you don't feel restricted because you want to be perfect. You want to just ensure that everything is perfectly done. Um, it doesn't have to be directly on the insertion, right? But you have to ensure that the muscle you want to treat, the muscle you want to either facilitate or inhibit, is transversed by the, what is it called, by the therapeutic zone. Now, let's do some real stuff here. So I'm going to explain so much right now, so much. If you have your friends somewhere, tell them that Coach CJ is about to do the demonstration that they've been waiting for. I know some of them, they've come here, see, they saw theory and they ran away. They're like, what kind of thing is this? Theory again? After all my school years, you want to come and do theory again? They disappeared. So tell them to come back. That is demonstration that we are now. I'll use demonstration to teach. Let's leave the theory for now. Okay. So now I'm going to start by cutting the tape. So you have to ensure that you are cutting enough length to work on the muscle that you want to treat, right? The tissue that you want to treat. Okay. So you can measure out, let's say, if I want to work on the shoulder, for example, from here, you know, I can measure out. This is what I usually do for my patients. I can just go something like this, right? And I ensure that I at least have enough, distance to cover that tissue, that muscle tissue. Then I know that, okay, there will be an anchor, there will be an end, which are zero tension, right? Zero tension. So I measure out. So let's say we're measuring this. Look at this. Okay. Look at this. Okay. So I'm going to just cut. Okay. So now this is what we have, right? And I just fold them. This is how to cut the tape. You can fold this way so that you cut at once. Or if you're still a novice, if you're still starting, you can just hold this way, right? See, this one is facing outwards. It's not a must that one side will be. Somebody is saying up temper, stop that, stop it, stop this, don't do that. We don't do up temper here. We don't do up temper here. We don't do that. As if I was not holding myself back from jumping, but it's well. So we just maintain steeze. So look at this. I can cut this one this way. You see how I did this, right? You have to be meticulous about, okay, not so meticulous, but at least it should be a fine cut. Now look at this, right? I can now come here and cut this one this way. Okay, let me show you from this angle. No, this way. Just cut and go like this. Okay, so you see there's a fine smooth edge. So you have to be careful while cutting this so that you don't end up wasting all your tape in the name of cutting tape. So look at this one. This, okay, this is, just cut it like this, and this is what you have. So you see, it's smooth. One of the reasons it has to be like this is because your if it is not even, if it is not smooth this way, it's going to be easy to rip off your skin. So when you're putting on your clothing, it catches on the edge, those sharp edges, it catches on it. So this is what we want to do, right? So I'm trying to maybe do to facilitate this muscle, right? Let's say the anterior fibers of the deltoid, okay? Or should we use lateral deltoid? Should we use, how do I even position myself? Ah, okay, let's use the anterior fibers of the deltoid. Let's use the anterior fibers of the deltoid muscle. So I hope you can see, I hope you can see it. Can you? So this is what we have. I'm not seeing comments again. What happened? I want to see your comments, so please comment. Let me know that you are still following me. That you're not left me behind. I've not left you behind. So look at this, and I'm pulling this out, right? Okay. Oh, you're concentrating. I love that. So now, if I want to, let's say, facilitate this muscle here, if I want to facilitate these anterior muscles here, focus. If I want to facilitate these muscles here, right? I want to go up like this. See what I'm doing here, right? And just lay this down. No tension at the ankle, remember. No tension at the ankle. Oh, this is my camera hole. So no tension at the ankle. I've laid it down, and it is towards the origin of the muscle, above the origin. Okay? Now, you hold down that part. It is really difficult to do this for yourself. Okay? I'm only able to do this because I have mastered it. I've applied, I've taped, in fact. At some point, it was as if I was going to rename myself. Maybe my nickname, my surname will now, my middle name or my last one name, Sha, will be Kinesiotape. So look at this, right? You are holding that one that you have applied. You hold it. This, there's zero tension here. So like about 1, 2, 3, 4, something like this, right? Something like this. The size of my thumb, can be my ankle, okay, and my end. So zero tension here, and then I hold it. One thing that I do a lot is to pull. Remember, you must have done skin toileting. The skin shouldn't be oily or wet. Okay. Okay. So now you go this way and pull. Okay. Pull. See what I'm doing? Pull this way. Now, when you pull, you hold the edge. So you see the way this one is now. You see the way it is. Okay. I'll hold it. I'll hold that my end, right? Because I don't want tension to be at the end. Now, what do you do? Because you want to also facilitate, if you are taping, always put the region that you are taping in a stretched position. So that anterior deltoid muscles, I can just put my hand backwards like this, or you can ask the patient to cross the hand and put it at the back, right? Put it at the back like this, and then you stretch the tape and layer it down. Can you see this? You stretch it and layer it down. So when I've gotten here, then remove this, right? Remove the backing paper and layer down, bring the hand back, bring it back, and then layer down your end. Okay, bring the end down. So you've gotten this. You have a this, from this zone now to this zone, that there is actually tension. That is your therapeutic zone. That is where the recoil direction exists. The recoil tension exists. So you stretched at that point. Now, the recoil direction, who can tell me, with what I did now here, do you think, will it be, be facilitating or inhibiting? Facilitating or inhibiting the anterior deltoid? What did I just do? Facilitate or inhibit, from what I have explained so far? Thank God this one is not a case of decrease or increase, that you can just say creases. Does it facilitate or inhibit the anterior deltoid? This technique that I just used. Somebody said facilitate, somebody said facilitate. Okay. Facilitating, facilitate. Amazing. Amazing. Good. Good. Excellent. Okay. That's fantastic. That's fantastic. So now let's do another technique, right? From all this, I'll keep explaining some things for us to understand. Okay. Now, this can also work for pain relief, right? But before you, somebody said inhibit. Who's that person? This thing can be a bit confusing. It's fine if you are not, if you don't get it at once, it can be a bit confusing. But remember that I said, if I am taping from the direction of the origin down towards the insertion, I am facilitating. So this is what this thing literally does. It kind of pulls this upward, right? It kind of pulls this way. That's the direction of recoil, because I started here and ended here. But if I start here and end here, it will kind of suppress, inhibiting the action. The recoil direction is going down, okay? Down this way. Recoil direction is opposite to where your taping is starting from, right? Your taping direction is opposite to your recoil direction. So if you start here to tape, recoil direction goes like this, right? And if it is going like this, it is facilitating. Just imagine that there's an invisible hand pulling up like this, pulling up like this. That's what it's doing, kind of. Okay. And you will tend to appreciate these things when you practice on yourself, you practice on your friends, you practice, a lot. So now, we've done this. Now remember, if you want to deal with, we'll go through when we are done with this that I'm showing you now. You have an idea what we are talking about. Then we'll go through, the other dynamics when it comes to taping, right? The amount of tension that you are using, where you are actually applying, and all that. I'll explain all that. What I'm doing now is just for you to see how it is done. Okay. Now, when it comes to manual direction tests, if I want to apply on this, right, for example, and let's say it is pain that I want to tape for. In inhibiting, will you also stretch the muscle while applying? Yes, you can. You can put it in a stretched position and apply. Okay. But it's more important when you are trying to facilitate. Okay. Now, this muscle, if I am trying to deal with pain, manual direction tests, or even facilitating movement, right? If it is muscle facilitation, maybe kind of supporting muscle strength, right? You can, just the way the anterior deltoid is, and you know that the function is, you know flexion, forward flexion, right? So if I want to facilitate before taping, I can use my hand and provide a manual glide to that area. Just go for someone that have knee pain. Okay, how do you tape? Hey, that means I'll have to show my knee. I'll get to that. I'll get to that. Okay, I'll get to that. I'll get to that. I'll do a few more demonstrations before we round off. So now you can do a manual glide, right? And ask the person to, take the hand up. So now, for a patient who, let's say, they are not able to get up fully, maybe full range of extension. Oh, sorry, yeah, extend forward. This is flexion now. This full range of forward flexion, and they're not able to like go beyond this range. For example, you want to enhance the concentric action of the anterior deltoid muscles, right? And then the biceps and the rest. But like if you are able to isolate the anterior deltoid and the biceps, you can provide a manual glide upwards, at the shoulder joint. Provide a manual glide this way and ask them to repeat the same movement. So if you notice that when they repeat the movement with that glide, that there is an additional movement that they are able to perform. There's an additional, movement that they are able to get with your glide. Then you can now apply in that direction. You can now go ahead to apply the tape. That's what manual direction test is about. If I am trying to work on pain relief, right? And I do the manual direction test in different directions, right? So you want to know this pain that the patient is having, will it be relieved if I inhibit or if I facilitate the muscle action? If I use this particular technique to tape, will it be will it be will it be, what is it called? Will it be inhibiting? Does I'll answer the questions at the end. I'll answer the questions at the end so that we can have a flow with this. Now, if there's shoulder pain, let's say anterior shoulder pain, and I do my glide test, my manual directional test, if I go up this way, right, and ask the patient to move and check for the pain, and they go, okay, yes, 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 it's there. You can do another thing, which is to provide a downward glide. Okay, so you glide downwards and ask them to repeat the movement, and then they go, okay, it actually feels a lot better. So you can see the difference. Sometimes you can do, let's say, upward glide, and they're like, okay, the pain is still there, but it's reduced. Now you do a downward glide, and they're like, oh yeah, wow, wow, it feels much better with the downward glide. So what you will now do is the direction of your glide should be your recoil direction. Okay, somebody said I should do the manual direction test again. So let's say this is the muscle that I want to treat, the anterior deltoid. Okay, are you there? This is the muscle I want to treat, right? And there's pain here upon movement. While I try to go like this, there's pain. Okay. Now, my as the therapist, you can provide a manual glide on the tissue. So you go like this and ask the person to produce the movement that causes them pain. So let's say what causes that the patient pain is going upwards this way, forward flexion. And when you do the glide and ask them, okay, do the movement, and they're like, okay, it hurts, but it's actually better, like it feels a bit better. And then you do the glide again, this time in the opposite direction, right? You go down, okay? So this glide can come in different ways. It can even be, sometimes it can be pressure. It can just be pressure on the skin. There's a lot to this, but at the basic level, if I'm now doing downward glide and then ask them to take it up again, and they're like, oh wow, it feels good. It feels good. So that could be a sign that maybe the pain is as a result of overriding muscle action. However, whether or not it is a particular thing that you think, the most important thing is, what does the patient feel better with? And that's why it is important to experiment. If you check this direction, it's not what they are feeling better with. You check the opposite direction and they feel much better, then tape in that direction. you know because at some point you may be biased. Your brain will be telling you, but I learned that for this taping technique it has to be like this, it must be from this to this. No, each patient will even respond differently at some point to taping. Okay, so you have to be able to adjust your technique as you learn more about your specific patient. Where would the recoil direction? When you stretch the tape, the direction of recoil will be back to the anchor. It's just like rubber band. See, if you put rubber band, if you want, you can try it. If you put rubber band on your mouth, right, and bite it and hold it, and then you pull it far and leave it, where will the rubber band end? It will come back to you. Okay, that's the same principle basically. So you are anchoring somewhere, you are anchoring at a point, and you are ending at a point. So the recoil direction is going to go back to where you started from. So this is what I have. Now let me show you what I meant. So this guy, this guy here, you know, this guy is, you know, so let's say I want to facilitate his lateral deltoid, right? I want to facilitate the action. So what I want to do is this. So watch how I tear this, how I rip the backing paper. Everything with this, everything with this tape thing is skill, is technique. See how to read the paper. You just hold it from a point like this and pull, as if you want to tear something. The way you want to, you're angry with your exam score, you want to tear the paper like this. So this is it, right? You've ripped off this part, and this part is your origin, right? Your, sorry, not your origin, your anchor. So you anchor here, right? You anchor at this point of origin, right? And then you hold that anchor, right? And then you pull this, and then stretch, put the muscle in a stretch position. It doesn't have to be stretch position, like you don't have to like stretch the muscle, it's not a must, right? But you can ask the person to maybe adduct the shoulder, and then you stretch and go down. I know the question in your heart right now may be, oh, what amount of tension should we use? What amount of tension? How much stretch? How do I know if I am overstretching or understretching? So now I will explain that later. So you see, you come and boom, this is what we have. You get to the end. Do not stretch at the end. Just layer down. Okay? Layer down, zero tension. And I don't know if I can still, God of mercy, this thing is so aggressive. It has already glued to the whiteboard. Has already glued to the whiteboard. So no problems. Later I'll start using shea butter to remove it. Be baby oil, whichever one. But it's just so aggressive. So now this is what, no, sorry, this one, right? Now if it's like this last one, okay. So we have 15, we have 15 more minutes. So this re- is to the record direction. Those Does that mean we tape in the opposite of the manual direction? No, 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 no. Manual direction test is the test that you as a therapist will do to determine what direction you want to tape for the patient. Okay, to determine the direction you want to tape for the patient. So if you discover that gliding upwards will give you what you are looking for the patient, gliding upwards will improve the patient's situation, the patient's pain, or facilitate the movement of the action of that muscle. The manual direction is positive, right? The manual direction test is positive. It means that taping will help. That's just what you are trying to determine, right? So you will now follow the direction that you use that gave you the result you are looking for. And that direction that gave you the result should be your recoil direction. That's all. That's all I'm saying. Is that clear? Yes, you have to do gliding test before taping. You have to, except you are doing generic taping. There are some of them that don't require, manual direction test. Let's say you are taking for knee osteoarthritis, for knee joint support, or for shoulder joint support. So let me quickly do this one. Let me quickly do this for shoulder joint support. So this is me cutting my tape. Okay, this is what I have. Tape 1 and tape 2. Tape 2. Of course, it's not every question I can answer this night. It's not every question I can answer this night. This thing, this you see here, I teach taping for, I can teach this thing for 4 days, 5 days, right? And max minimum of 1 hour 30 minutes per day, 3 to 5 days, minimum of 1 hour 30 minutes per day with time for practical. Now, I have worked with somebody one-on-one. I wish she's here. I worked with her one-on-one. She is in Lagos, and I trained her online. I trained her just the way I'm doing it now. And it took us time. It took us a long time, right? But what I'm trying to give you is a good understanding, is a fundamental understanding behind taping, for you to know how it works and then know the principles. behind the application. That's it. Okay. So I may not start going into, if I want to start going into all the taping techniques, we'll do for facial palsy, we'll do for Achilles tendinitis, I be do for plantar fascia tendinopathy, do for elbow, all those things, right? But then you have the basic understanding. Studying more, right, would be a bit easier for you now. With the knowledge that you have attained right now, going ahead to look at taping, you'll be looking at it from a different perspective. Okay. So it's no longer from a point of, oh, I'm not sure I can learn this, or this thing looks so abstract. It's now, I mean, you have a good understanding of it. And yeah, I think you do, right? So the basic understanding, you can take it further from here. You can start learning more from here, right? If you want to go for additional programs, fine. If you want me to coach you personally, privately, one-on-one, that's also fine. You know, if you want us to work together, if you want me to come to your clinic and teach your staff, I can come, right? But it's going to take a bit more time to actually start mastering all these things by sections of the body, right? Taping for the head, head and neck, taping for the extremities, the trunk, the even abdomen. There's a lot of utility for this thing, right? I have used this for a lot of people, for pregnant women, for you know different cases. So back to what I wanted to do. I wanted to tape the shoulder for support, right? So this is the first tip, and I'm going this way, this way. Look at my ankle. Look at my anchor. Yeah, this is the ankle. So this goes up around here, and then hold this point and pull. Just pull. Okay. And you see, you can use around, okay, I will explain the tension to you, and go, you see, this one goes back behind. See what I'm doing? And then layer this, bring it back and layer this one down. So you see how it is here. Okay. See how it is. Now, the next guy here, this guy, I'm going to tape this one, and starting from the back, I used this in treatment of Erb's palsy. Yes, I have applied. How can it be applied to give effective results? Identify the muscles that are weak, right? And then you apply. But you have to be careful when it comes to Erb's palsy patients, because there are not a lot of tapes that are compatible for children's, the skin texture for kids, right? So you have to actually test out every child, do a skin sensation test, skin sensitivity test to the tape before you apply. So this is actually a bit difficult for me because I'm applying it on myself, but I'll still be able to achieve what I'm looking to achieve. So this is it. Can you see this? So I, put this one, come forward this way. This is what I usually tell patients. Go from this, cross the hand to this side. So that puts a stretch on the back, this muscle here, right? The posterior deltoid region. And then I stretch and, come all the way, right? This way. And then I layer this one down. Okay. So this actually helps to support the shoulder joint. I have used this to manage a woman who has had 10 episodes of shoulder dislocation, and she was put on the consultant gave her shoulder slings to be carrying, shoulder support, this shoulder arm sling to be carrying, and she was just every time carrying, and she was so apprehensive, so afraid. She couldn't do activity, she couldn't lift things, she couldn't do anything. So she was just scared. But when I started seeing her from the first session, I taped her and she felt so much better. She was able to do some movements, to make some movements, like take her hand to the back and all that. And I told her, okay, don't discontinue, because weaning has to be planned. Weaning a patient from what they've been used to, it has to be strategically done. So I said, don't discontinue the support, the sling. Continue using it for now, right? The time is going to come, we'll keep doing strengthening exercises. Because one thing you also have to understand is that taping is not standalone. Concerning the question of using it for paralyzed muscle, can taping be used for muscles with power of 0/1, 0 or 1? No, no, no. One, yes, depending on what you want to achieve. Okay. Zero, I can argue a case for preventing foot drop or preventing wrist drop, right? I can argue the case for the use of kinesiotaping. However, you have to be very sure that you are actually aggressive, or not aggressively, intensively rehabilitating the limb or whatever segment of the body. So, like I was saying, um, I've even forgotten what I was talking about. What was I talking about? Hmm. What was I talking about? See, that's why I find it hard to just. I'm seeing a lot of questions here, and it's overstimulating. So, like I was telling the story about the woman, right? We were able to commence strengthening exercises. So, taping is not a standalone therapy. Good, it's not standalone therapy. You don't just tape a patient comes to your clinic, you tape a patient, and then you move, and that's all. No, you have to be able to integrate other things, right? Yes, the purpose of taping is to give you a good environment for healing to take place in a better way, okay? To reduce pain while they do their exercises. So there are patients that I have seen, they come to the clinic and then the pain is just so much, you're not able to do much. Maybe it's knee pain, OA or something. And I tape. I've encountered some patients that I almost landed myself in trouble because they will come and I noticed that they're in a significant amount of pain. The knee is so, it hurts. I'm like, okay, let me tape this patient so that when I apply the tape, they'll feel better. Then we can do the exercises. Do you know that after applying the tape, patient stood up and ran away, stood up, dusted her clothes, and said she is busy, and she feels better, and and she has work to do. It feels much better, and it's okay. And then she went her way. I couldn't stop her. She's actually a very senior staff. So now back to the using stroke for shoulder subluxation. Yes, you can. I've actually used it for um cases of subluxation. Now, the patient I was talking about, who has had 10 episodes of shoulder dislocation, the 10th one landed her in the emergency room in the theater. After that, we had about 3 sessions. She felt too confident to discontinue the use of the arm sling. She stopped using the arm sling, and then we started more intensive strengthening exercises with the tape on, because whenever I remove the tape, she doesn't feel so confident to actually use the arm, right? So we kept on, no problems, praise Banky. We kept on doing strengthening programs. The shoulder became stronger and all that. And that 10th episode she had was the last one. She will come, I'll tape, we'll do exercise. I drilled that lady with shoulder strengthening program so much, right? And she got so much better. We discontinued the taping because it was no longer of any need. It wasn't of any use. So that's one of the things that I want you to understand. Okay. So this is just for basic understanding, basic introduction. Now look at this tip. Before I go back, I'm going to go back to what I was presenting. I'm going to go back to the whole contraindications and precautions, right? Now look at this tip. I'm going to cut again. I don't cut this slowly though. I usually just trim the two edges round, and look at this. You can rip from the center. You can rip from the center. You can rip from the edge, depending on where you want to apply. Different applications can make you want to pull from the center. But let's look at this tape, right? Let's look at it from this view. I've ripped it from the middle, and let's say I want to apply, right? And this is my anchor and my end, for example. Now, this stretch on this tape, this is the full stretch. It can't go anymore from here. This is 100% stretch. It can't go any further. Now, this is, if I reduce it just a bit, just a bit, just a bit, it's like 90. Just a bit is like 80. Just a bit is like 70. Again, like 60. Again, like 50. Again, like 40, 30, 20, then slack. Okay? Slack. This zero. I mean, obviously there's a pre-stretch on the tape, so it's going to still be, yes. Can it be used for arthritis? Yes, yes. So this is a full stretch, and just a little bit, as if you are imagining just a little bit of release on it, is 90, 80, 70, 60, 50, 40, 30, 20, and slack. So you can always, even if you do not know exactly the tension to use, this has been my trick so far, right? Even if you don't know the exact tension to use for a particular condition, you can play around 60. That means it is not too much and it is not too less, right? It's not too much, it's not too little. So around the range of 50, 60% stretch on the tape can still give you the results that you're looking for. So something like this, something like this, you stretch just a bit on the tape and then you do your application. So if I am taping for support, so let's say rotator cuff injury, that I'm taping for shoulder support, this would help. Then I can also go this way and cross around the the muscles that are hurting. Go like this and this. I know you may not see what I just did now. So you see, I've just done a good stabilization technique for the shoulder joint. Okay. How do you anchor and end consideration for low back? Okay, I think we'll probably have to create a standard paid program. I think that's what we'll do. I think that's what we'll do. Okay. So that we'll be able to cover all these things, all these questions that are being asked. There are a lot. Um, well, that one is not something I can say for now. I would. Okay, let me just finish. I'll think about this. I'll think about what to do. I'll think about what to do. Because what I've been considering, basically, even before she invited me, I've been considering doing this training program in Abuja. So for physios who are in Abuja, for physiotherapists who are in Abuja, that one is one I can promise myself. We can find a place and then we'll do all these different demonstrations. I've done the training for National Hospital. Another group reached out, another clinic reached out to me recently, so I may as well be doing the training for them. And so I'm thinking of also having a group of people, right, that we can maybe go to Millennium Park and then we go through all of these different tipping techniques, if that works. So that's the one I'm sure I can promise myself. So good. Now back to our presentation, right? Back to our presentation. Um, so okay. So yes, um, follow through general contraindication. This is where we stopped. So do not apply over malignancy site, active cellulitis or skin infection, open wounds, DVT. Okay, avoid using heat sources on the tip like infrared. Don't use infrared over the tip. Okay, don't use hot pack over the tip. The heat will activate the adhesion, the adhesive, and it's going to be very strong on the skin, very, very strong. So it's going to be difficult to take off, right? Um, you can sit on wax, with wet towels or something like that. Then you are later on, but it's just going to keep activating. So while the patient is on the tip, there are different things that you can still do. You can use TENS as long as your TENS is in contact with the skin. You can still use your TENS, right? You can use your cold therapy, your ice pack and all whatnot that has to do with ice. You can still do cold therapy. You can do massage, but without lubricants. You can use your hand to glide over the tissues and all that, without having to apply lubricants. You can use massage gun over the affects the tape. So the tape goes off. So while the tape is on them, after a while, let's say after 5 days or 6 days, depending on the appointment, do all the treatment that I have to do, maybe the STM and all that with Neurogesic or shea butter, whichever one. And I would go over again to do skin toileting, to wipe the skin very well, and then I tape. And then they can go stay for that next 5 days, come back, and they're like, okay, the tape days. Can you hear me? Bolanle, please reply. If you can hear me, reply, please. So some of them will come and they'll tell you, oh, the tape was on my back for 5 days, and it came off on the 6th day, and that was when I started feeling a little bit of pain again. So that's how you also get to know that this thing actually helps the patient, the feedback that they give you. So these are absolutes. These are these are absolutes. Let me see. Okay, avoid using heat sources. Do not use tape to pull into position as rigid taping. So some people think that for this taping to be effective, they have to use it and pull, right? So, for example, I've seen that a lot with facial taping techniques. Facial taping, where a lot of I'm trying to look at the screen and look at my camera hole. Sometimes I forget that this is where my camera is. So this is you. So some people think that they have to use the tape and drag into position. So they think, oh, because this one is going like this, I have to start my taping here, and then I'll now use it and pull. That's the way rigid tape works. But kinesio tape is not rigid tape, right? There is a recoil action. So if you're not taping correctly, you can actually be damaging the muscle, or you can actually be, doing more harm than good, right? You can be reversing what you wanted to achieve instead of achieving it, right? So you are not using this tape to pull into position. So if, let's say, you want to activate muscle, you are not literally using this to pull, right? So that's what you do with rigid tapes. You don't do that with kinesio tape. Now, take extra caution when taping into sensitive areas like the back of the knee, like the axilla, you know, like the sides of the neck and all that. Be careful while you are taping. In fact, it's advisable to avoid sensitive areas like the popliteal fossa and the cubital fossa and the armpits, the axilla, right? It can be very uncomfortable, very, very uncomfortable. And then this part of the neck, because I have this, I can tell you because I've I've experienced it. This part of the neck, if the tape is up to that point, essentially this sensitive part, it can be very uncomfortable. So the absolute contraindications, simply what you can still apply tape. You can still apply You can still apply tape, but you have to be careful, right? That's what it means. So open wounds, you don't apply over open wounds. You can apply around the region where there are no open wounds, but do not apply the tape over cuts or abrasions. Now, the skin condition, don't tape over rashes, infections, or allergic reactions. Don't tape if the patient has DVT to prevent contraindications, to prevent complications. Sorry. Now, diabetes mellitus. This is under relative contraindication. You have to monitor the skin and circulation regularly if you are taping, right? Um, Exercise caution. You know why? If you tape a diabetes patient who has peripheral neuropathy, they may not know if the tape is actually reacting with their skin. So it can give them maybe burns or rashes, and because they don't know, it goes worse from there, becomes an injury, becomes something else. So you have to keep constantly monitoring the region around where you taped. Now, the exercise for pregnancy, exercise caution when taping the abdominal area, because the taping can stimulate contraction of the uterus. Remember, biotensegrity. The tissues, whatever affects the skin affects the tissues beneath the skin. Okay, so fragile skin, elderly patients, and children, beware when taping. Take extra caution when taping them. So the aftercare, activity and monitoring. Patients can engage in normal activities, including exercise and showering after taping. Check the skin for signs of irritation or allergic reaction. Remove the tape slowly in the direction of hair growth to avoid skin irritation. Use oil or adhesive remover if necessary. So you can use baby oil, you can use methylated spirit, right? And just dab, put it in cotton wool and dab it on it, and allow it to stay for a while, and then gently peel it off. If the person is still in pain, maybe add more dab more methylated spirit, add more oil or something, or you can use glycerol based soap, oil based soap, and then rub over that. And after a while, you take it off slowly in the direction of hair growth. So, like, if I want to take it off, this is this is the way my hair, you won't be able to see this, you definitely not be able to see this. But if your hair is growing down like this, the hair is growing like mine is, this is the way it is, this is the way the hair is growing, right? The hair is falling down this way, it's lying this way, right? So if I want to remove the tape, I wouldn't be removing this tape from down here this way. If I want to remove this one, I won't remove it from here. I will remove from up here down to follow the direction of hair growth, okay, to avoid skin irritation. Now, um, I've already done these case studies, I've already done these examples, and I think this is where we would call it. Okay, so this is what I'm going to say. This is what I'm going to say. Um, I just hope that I hope you were able to at least gain the fundamental understanding of kinesiotaping. I hope you were able to pick up something, one or two things from this presentation. Though, yes, I know the time is limited, but I want to hear from you. So far, how has it been? How has it been? Did you enjoy the session so far? So far, I want to hear from you. I want to see your feedback. Okay. The mm, okay. So what we are going to do is this. Um, so if you are here, she's going to send a form after this session. Okay. Fill the form after the session. Fill the form and put your name there. Put your name. My only concern, I do not know the amount of work that will be going into it, it's going to be a lot if they're going to have to create certifications for all the participants. I mean, those who participated in this. But fill that form, okay? Give your feedback. Also, come to the group chat and share your experience learning tonight. Okay, so those are the two tasks. Now, one thing that I want you to do if you are here, quickly click the like button on this video. Okay, hit the like button. It's optional, you don't have to, it's not a must to do it, but hit the like button. I would like to know how many people came across this video. And then if you're watching this as a replay, you can also share your comments, put down comments in the comment section. And I'll definitely be glad to see that. You can subscribe to this channel. This is my channel. I wanted to do this on a separate channel. I wanted to create a separate channel because here in this one I do a lot of other things, life coaching, public speaking, a lot of other things come in here, sales and all that. So if you check, you'll see all those contents. But this is the only one that I have the leverage of going live with, so I just had to make use of it. Okay, but the video is unlisted, and you're going to have it. You're going to have it. You're going to have it. Fill that form, and then send in your feedback. Then other basic tasks that are not compulsory: subscribing to the YouTube channel as a way of supporting the growth of the channel. And then any other thing that you want to do, like, share, whatever, any other thing that you want to do, you can share with your friends. So that's what I'll say for now. Thank you very much for joining. I can see this is 2 hour mark. This is 2 hours 6 minutes, and we still have 95 people live. That is absolutely amazing. That's absolutely amazing. I celebrate you for all the work you've put into your growth. And I believe me, this is going to the effect is going to run longer than you can imagine. So I want you to pick more interest in kinesio. Go and learn, go and try out stuff, get to um corner your friends and tape yourselves one after the other. Take turns, learn, practice, teach yourselves, and you definitely get the hang of it. So if you want to take up additional training, you want me to teach you privately, you want me to do a group training for you, you have plans, for any of that, fine and good. I'll make myself available. If you're also in Abuja, a clinic, a hospital, physiotherapy department, and you want me to come and train, I will gladly come around, particularly this month of November, early, I mean, first half of November. So I'm going to give the floor to, oh, Bolanle is not here. I wanted to say I'll give the floor to Bolanle, but she's not here. So this is it. And I know a lot of people are going to watch from India by tomorrow. They're going to be watching it from India. I know the problem that they were experiencing is time zone differences. India is, I think, 6 hours ahead of us, right? 6 hours, I guess. So they told me that they won't be able to meet up with this session. So if you're watching this as a replay and you're my India family, you're welcome. You're welcome. I hope you also enjoyed it. Once you are done watching the video, go ahead and fill the form in the WhatsApp group. We'll keep resending the form. And please do not leave the group. There's a lot that may go on. I may decide to offer a part two. So if you want a part two, let me see. Let me see. If you want a part two, if you want a part two, comment in the comment section. If you want me to do a part two, hey, hey, hey. I hope I'm not promising what I cannot do. In my busy life. But if you want me to do a part two, let me see your comments. Comment part two, part two, part two, part two. Let me see. So that I'll know if we can negotiate that. Okay. So those that are going to be getting these certifications, it's a basic certification, certificate of participation, right? to show evidence that you actually attended and you learned about kinesiotaping tonight. Okay, those that will be attending are those who do these things that I said. Go ahead, fill the form that will be sent. Is a post evaluation and post training form. You must have filled the pre-training form, right? You must have filled the pre-training form, then you fill the post training evaluation, right? So we'll have to compare both of them. Okay, so we want to know the effect this session has had on you in terms of confidence and also some form of competence when it comes to taping. So at least some people used to be afraid of, when they mention kinesio tape, they feel scared, they feel challenged. It's not rocket science. It's just like every other thing that you've learned, and it's something that you can also learn to use very well. Okay, so fill the form, follow, hit the like button, go to the group, comment, share your experience learning from me tonight. Okay, share your experience. And this is largely sponsored by Neuro Rehab, and this is the Kaduna PTDOS Physiotherapist Day of Service project. And I'm excited. I'm more than happy to do this with you all. So that's basically what I'll say for now. So you have an amazing night. Okay. Okay. Oh wow. I'm seeing part two. Part two, part two, part two, part two, part two. Okay. Ah, okay. Part two, part two, part two, part wow. Wow. Okay. Wow. Somebody's joining from India. That must be like 1 a.m. or no, maybe like 2 a.m. over there. Wow, that's amazing. That's amazing. That's amazing. I can see you, Thalori, Pravanya, Thalori. Thank you for joining. That's a lot of sacrifice. Good to have you here. Good to have you here, really. Welcome. So, okay, part two, part two, part two. Okay, fine. Oh, that's amazing. That's amazing. So, those in Abuja, you can also come to me. Let's talk and arrange something. Um, we'll see how to make it work for those who are in Abuja. Then for this part two, I will consider it. I'll consider it. Definitely, I'll consider it. I'll consider it. Hey, okay, okay. So yes, this is good. We've come to the end of the session for tonight. I'm going to give like some minutes. Yeah, some minutes. Thank you, Fatima. Thank you. Thank you, everybody. I'm going to give a few minutes for those who are still watching, who are still like maybe 2, 3, 4 minutes behind to catch up. Okay. Thank you, everyone. Thank you. Let me start reading all the comments. Mm, wow. 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 Yes, the replay is going to be available. For those who are asking, it's going to be available on channel this channel. So that's why I said you should subscribe to the channel so that you have access to it. You can always get notified about sessions that I'm having. And remember, don't leave the group. Wow, I am very much glad. I'm very much glad to see these comments. Ashley, Myla, I'm in love with kinesio. Amazing, amazing. Okay. Oh, that's good. That's good. That's really, really, really good. Thank you. Okay. So let's go. The session was very easy to follow and understand. Thank you. Thank you. I'm glad. Amazing learning experience. Wow. I'm glad. I'm glad. I'm glad. I'm glad. Amazing learning experience. Thank you so much. It's indeed a wonderful session. Was an interesting session, really informative. uh I gained from the session. Oh, cool, 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 cool. If it's like this, hosting a part two will not be hard now. It won't be difficult for me to decide. I'm glad that you all really picked one or two things from this session. I'm really glad. I'm really glad. From India. Okay. Amazing. Really informative session. Thank you. Good, good, good. Thank you for the presentation, Doreen. Amazing. Nice one. Are you going to upload the live? Yes. Forget the name. Good, good, good. I'm glad. I'm really, really, really glad. I'm really glad. So we'll consider having another session. We'll consider having another session so that all those who have questions can ask questions, more questions. We'll do more demonstrations. I will explain some other things, you know, as the case uh calls for it. So good. I'll be logging out in a few minutes. I'll be logging out in a few minutes. Part two, part two. Amazing, amazing. We'll do that. We'll do that.